very simple thing that all of us know. Harm reduction works.
That's right.
But harm reduction needs a little bit of help legislatively to be able to work even better. And that's precisely what we're here to do today, to talk about syringe access. And the way that we do it is by destigmatizing and decriminalizing the possession of syringes. It's that simple.
I'm tired of individuals being harassed, being arrested because they can't get access to syringes. I work on the streets on a daily basis. And syringes, they may not be harassing people that much, but the fear is there because it's been placed there by NYPD. Individuals don't want to stay, they want to cop, get the syringes and go, and not receive the services that all of the harm reduction agencies are providing.
A lot of people forget that until 15 years ago, unless you got your syringe through one of a relatively small number of needle exchange programs, there was no legal way, without a prescription, to possess a syringe in New York. We were one of the very few states with such an outmoded law. It finally became law thanks to the very smart and sensible and very courageous effort by then Governor George Pataki. This has long been a bipartisan issue, and a lot of the legislation we've accomplished in this area in the years since has been done on a bipartisan basis because it is smart public health policy.
I am a proud member of the governor's Ending the Epidemic Task Force, and we just submitted our blueprint, our recommendations to the governor for approval on Tuesday. And one of our key recommendations is to ensure that every single New Yorker who needs a clean syringe can get access to a clean syringe.
Yeah.
It's a recommendation that mirrors this incredible legislation that has been introduced.
The story will need to be written, and it's going to be written about how we as a state and as a society had such a hypocrisy about sex and drug use that we allowed people to die needlessly. We are in 2015, and we have two proven methods of prevention. Before the biomedical, we know condoms work, we know syringes work. There's no need to get crazy and political and storming. Clean syringes every single time.
It is now crystal clear that New York's law, as far as it goes, has saved tens, perhaps hundreds of thousands of lives and prevented tens or hundreds of thousands of HIV and hepatitis C infections.
One of the great things that this piece of legislation does is it seeks to take away one more tool in the toolbox of oppression for Black and brown people in New York City and around the state. All right, so let's be clear about that. I think that's something that it's really important for us to focus on.
We're all about the safety of our communities. And so another reason why this legislation is so important is because it's a way to reduce unintentional needle sticks for people, including and especially NYPD.
Years ago, when we were advocating for syringe exchange, it was important to keep people alive because dead addicts don't recover.
That's right.
They have no opportunity. The effectiveness of the syringe laws in terms of keeping substance users safe and in terms of keeping the public safe is, the evidence is there. We run a treatment and recovery center here in New York.
There you go.
And that we get so many referrals from the various syringe exchanges, and they don't get any credit for that. But if the syringe exchange is not there, that individual who's using drugs and injecting drugs is in the underground. And if they're in underground, the only time that they're going to show up is when they're incarcerated or when they got to go into the hospital.
So if we, who are responsible, want to take are used syringes and responsibly dispose of them, then we've got to decriminalize so we're not at risk for harassment. It's the only thing that makes sense.
Anyone who needs access to clean needles and syringes will now be able to get them through this legislation. So I thank you for that. I'm glad to be part of it, and I want to sign on to your bill today.
It's not gonna be simple, folks. But with you folks coming up to Albany and with us talking every day about how this works, how syringe decriminalization is exactly the way that what we need to do to make sure that we can save lives, to make sure that we can make people healthier. It is good public health care policy. It is common sense public health policy. And I'm very glad and happy and proud to be standing here today with my allies to advocate for it. Thank you so much.
I'm tired of seeing people in my community suffer because of people biases and people want to put their belief systems and values on other people, which is not right.
We need a clean law on clean syringes. And that is what we are fighting for here, to clean up the law so that this highly successful, intelligent public health policy can save even more lives.
I got into this work because my parents took in my cousin when he was struggling. So when I was in the first grade, he lived with us. And he ran away in a couple years after that, and he became Hep C positive and HIV positive because he couldn't get access to a clean syringe. I loved him. I was in first grade. He was a teenager. I loved him more than anybody. That, you know, for many, many years he was my idol. And he's one of the he's one of the spirits who have driven me to do this work. And if there were needle exchange programs back then, he would still be alive today. And the founders, the co-founders of Vocal, Joe Bostic and Joe Capistani, both became HIV positive because there were not, even though we knew that it would be one of the most effective public health interventions since the polio vaccine, which is what needle exchange has been called. There were not legal access to clean syringes. They became positive and they lost their personal fights against AIDS in 2003 and 2004. So we are all of us up here are going to make sure that this bill gets passed and that these recommendations are realized so that we can actually end AIDS, because we can do it. We can end AIDS by 2020. Let me hear you all say it with me. End AIDS 2020. End AIDS 2020.